Good afternoon, everybody. Let's get started with our transit meeting with the Board of County Commissioners. Today's date is January 15th, 2025. The time is 2 p.m. In attendance are Commissioners Eberline, Duncan, and Matari. I want to call this meeting to order. Are there any changes to the agenda? Hearing none. Public comment? Hearing none. Let's move on to business. This has to do with the transit, and I'd like to just kind of give a quick opening statement just to explain why we're here. There's really two reasons why we're having this meeting today. The first one is that the auditing department needed some information from transit, and they were trying to get that information. The second reason is because we have a new commissioner, Commissioner Eberline, and just started this week, and I thought it would be a good opportunity as well for him to kind of be brought up to speed, to kind of provide some background. In FY 2017, it was RMO at the time, tax dollars were budgeted for about $185,000 for the department. Then in FY 24, fast forwarding, we had roughly about $419,000 budgeted for the department. FY 25, we have reduced that amount significantly to a mere $66,000 of tax dollars. And one of the things that we did was we took the salary that fell under the tax dollars and we moved it underneath the grant dollars. So now grant dollars are paying for much of this salary expense that we were originally levying for. And so because of that, there's a requirement for match with these grants. And we were using the salaries and the contributions from the salaries as an in-kind match. But since we moved it underneath the grants themselves, there's a need for match. Now, recently, Commissioner Eberline, we approved a grant, $1 million. It was an amendment to a grant, a $1 million grant where we would also provide $1 million in match. And most of that match, if not all of it, would come from Kootenai Health. And so that's a pretty big commitment. I was sitting around talking with some auditing folks, and I just asked, quite frankly, how does the Kootenai Health match work? And nobody could really give a good explanation on that. And that's really what kind of led to asking these questions. You know, one of the things about the auditing department, a lot of people may not be aware, is that they really kind of police the finances and the grants and make sure that we are dotting our I's and crossing our T's. They can help keep us out of trouble after the fact if there's an outside audit performed and they have a finding. We actually did have a finding in transit back in 2016, and so it's very important that we try to avoid these things as much as possible. So with that said, we have Chad Engel here. The first item for the business is just the Kootenai Health Partnership, and I was just kind of hoping that Chad, you could walk us through that partnership, what it's about, what the county does for Kootenai Health, what Kootenai Health does for the county, and just kind of walk us through that process, as well for the benefit of Commissioner Eberline.
Sure. Chad Engel with the Transit Department for the record. So the partnership with Kootenai Health has been something that we've had in place since about 2015 is when we had our first agreement with Kootenai Health. What it is Kootenai County Public Transportation and Kootenai Health have partnered to meet FTA objectives for improving access to NEMT services, which is non-emergency medical transportation. This collaboration has led to the development of a shared transportation intelligence system, so to provide these NEMT services across Coeur d'Alene, Hayden, Post Falls, Dalton Gardens, and Rathdrum within Kootenai County. So the partnership is designed to improve the cost efficiency, enhance access to medical appointments, and eliminate service duplication within the Kootenai Care Network. So Kootenai County provides the buses for Kootenai Health for the NEMT services, while Kootenai Health covers all operating expenses not funded by federal programs. So these expenses are then able to be used by Kootenai County to fulfill the match requirements for the FTA funding programs. So Buses are serviced by Kootenai Health, and that's according to a schedule that we establish. And it's part of our maintenance plan for Kootenai County Public Transportation. So with also oversight by our fleet maintenance manager. So we're able to monitor invoices closely, make sure that it's being done adequately to FTA regulations. And so those expenses for operation are then able to be used as match again.
Any questions?
I do. This particular grant that came awarded a week ago now, what is the performance period on that $1 million match?
Are you talking about the grant that was signed by the board back for the operations of fixed route and paratransit?
So-
'Cause that was not last week, that's been a while ago.
I guess I'm just referring to the $1 million amendment plus the $1 million match. So is that,
That's the one that the board
Okay.
approved a while ago, yeah.
okay. And so what is the performance period on that?
That ends so performance period ends March 31st, 2026.
Okay. So we have to have $1 million in match available through March of '26.
We have to have it available, ready to use if needed, correct?
Okay. All right. And then Kootenai Health goes to Rathdrum, even though CityLink does not.
Correct.
Okay.
On that, Chad, just, I thought the amendment was a performance period amendment. And so on 10-1, when you went before the board, I thought the performance period ended 12/31/25, is what it says in the minutes.
So that could be 12/31 on when we have the obligation as far as for the maintenance, but the actual performance period within the grant would be March of 2026.
Okay.
Okay, and that's Jelena Hildreth.
Oh,
For the record. So basically, what we have here is a system where we're using the federal grant money to purchase the buses for Kootenai Health. Kootenai Health hires, trains, and staff to drive those buses, and then they drive people throughout the Kootenai Care Network. And what exactly is the Kootenai Care Network? Because I've never really heard that as a defined term. I understand Kootenai Health has a network.
Yeah, it's
What
just,
would be the Kootenai Care Network?
it's just what Kootenai Health classifies as part of their, I mean, it's mostly them and any kind of partner that they have within their system, their network, so.
Okay. And by the way, I know we've asked a bunch of questions, and thank you for, providing that information. I know it takes time to do that stuff.
Correct, yeah.
So, my questions are really just kind of clarification of some of the earlier responses. Okay, so the Kootenai Care Network could include Heritage Health?
I'm not exactly sure if that's part of their partner agencies. That's just one that they have gone to before.
Okay, so they have partner agencies, or they have, so the formalized partner agencies within the county where they would give people rides to?
That's what they consider the Kootenai Care Network, I would,
Okay.
assuming that that's what they consider. the
Okay,
Kootenai
but
Care
if someone wanted a ride to Heritage Health?
They have provided rides in the past.
Okay. And then, are there any other questions, Commissioner Eberline? Did you have anything that you want to ask?
I'm trying to write, so it's
I know it's a lot. I mean, there's a lot in the emails and
there's
documents and stuff like that.
no more than you think I do.
Yeah. Okay, so that's kind of the partnership. We use the grant money to buy the buses. They use the salary, basically, and some administrative expense to run the buses,
The operational costs.
the operational costs, which includes fuel. And that is what we use for match moving forward.
Yes, and that's what we've historically done as well. Yes.
Okay, and then, with respect to using that match for whether it's paratransit or fixed route, if I understood your response earlier today, that the funds, I guess our 5307 funds,
Correct.
that it's implied that we can use the Kootenai Health. It's not necessarily explicit.
So what it is there's the 5307 program, which FTA has funding for. So as part of that program, you have fixed route and paratransit as projects within that program. So the match is able to be used for the 5307 funding program, and it's the projects within it that then would be able to be used underneath that. So that includes the fixed route and the paratransit.
Okay.
Yes.
Okay. All right. So would it be fair to say it's explicit or implied?
Well, they say that it's for the 5307 program.
Yeah.
So then I
That-
would say that it pretty well defines that it's for paratransit and fixed route at that point.
Okay. And the reason I ask is just because most of the documentation that we sent to FTA, it mentioned paratransit explicitly, but it didn't mention fixed route. And that's why, I'm kind of asking for the clarification on that, because it would seem like you would just say 5307 funds, as
Which is
opposed
what-
to paratransit, listing paratransit exclusively and not including.
So which is what we did in the new documentation, because the original was done fiscal year 22.
Yeah.
So that's where it stated paratransit, because that's what we were using it for at the time. But then when we changed our funding and the county no longer was doing salaries, then we had to reinvent the wheel basically and figure out where we can now talk to FTA and figure out where those match funds can be used for. And that's where we had the conversations with FTA and got clarification. And then we had new documentation that was sent to the board, and that was the one that was just approved by FTA. Like they stated in the email, they don't normally do it unless we're applying for funds, but they made an exception for our case in needing this concurrence. This meeting.
For
So,
the fixed route?
for just the valuation plan of Kootenai Health Match.
Okay.
And so within that new valuation plan, it says that it can be used for 5307, 5310 program funding through FTA.
Okay.
And so it states, to your point, that we can use it for the 5307 program, which then includes the projects of paratransit and fixed route.
Okay. I know we've kind of blended the two subjects. The second item is the grant match discussion.
Sure.
Unless anyone has any questions on item one, the Kootenai Health Partnership. Okay. Commissioner Eberline.
You recall the 501c3?
With the hospital?
There?
Yeah.
So that came about because of two liberal entities in southern Idaho, and that allowed for such as Kootenai Health to turn around and come back and operate under a 501c3. And so here we are stuck with Kootenai Health, and everybody wants to have good hospitals and all that kind of stuff. But in my opinion, when Kootenai Health is walking on two different things, it's a problem. So how do they get a bus ride for free on a 501c3?
Now, when you say how do they is
Kootenai
being, how do they get that?
Well, Kootenai Health is paying for the operations.
I understand
the
that, but
services.
but it's but who's going to pay the bill?
Kootenai Health is paying for the operational costs, and we with grant funds cover the buses. So Kootenai Health is footing the vast majority of the bill, and with this partnership, it's actually saved the county a significant amount of money in us being able to utilize these match funds and making it so that the county doesn't then have to contribute even more match funds to make the programs run. So, but yeah, Kootenai Health is footing the bill for their operation.
Philosophically, I look at it as a why did Kootenai Health do it? And it was right after this project, this 501c3 came in. And then they could, the board of directors could do whatever they wanted to.
Well, I mean, I can't speak for Kootenai Health, but it benefits both parties greatly. It really helps the county out, and it helps Kootenai Health out, and it also helps all the passengers who would not or could not make their medical trips otherwise. Because there's a lot of individuals that have zero transportation, they have zero family, so they have no other option besides using the Kootenai Health transportation or our services in order to get to these medical appointments. And that's why it's one of those programs, the NEMT services, and why FTA pushes so hard for these partnerships. And we are kind of a looked at throughout the nation as being that kind of partnership in which not many agencies have, but what they're seeking to do. And that's why FTA has put many different opportunities for other transit agencies and funding opportunities to do the same thing as what we already have in place. So, I mean, it's beneficial to everybody.
Some people disagree
As far as
this whole program.
okay, but yeah, like I said, I mean, it's proven to show enormous help for the community as a whole. I mean, you can go before many cities, you can go before many of the people out there, and if you ask the question, they would say it's an extremely valuable service. So,
And there's lots of things that I would say was not worthwhile. So, here we're sitting on a conundrum, so.
Let me ask you, does Kootenai Health keep track of, I mean, you have these ridership stats, but, the ridership stats they're not really easy to understand because, a trip, I think is what it's called. Mm-hmm. It's not really a ride, it's a trip, I consider a ride one person from point A to point B, but a trip would be one ride if you had to stop off and transfer and then get to the second bus to get to point B. That would actually count as two trips, even though it's one person getting from point A to point B. Does Kootenai Health keep track of the actual number of people it gives rides to? I mean, because there is a website where you have to enter in information, right? Or leave a message and somebody calls back. So it's kind of a dispatch service, right?
Yes.
So they're keeping track of a name probably and an address.
I mean, it's information that they input into our shared system. Whether they're keeping track of individualized trips, I mean, that would be a question for them.
Are there stops kind of like the fixed route where you can go from Kootenai Health to someplace else, or do they pick you up from your house and give you a ride?
Yeah. So it's not designated stops like the fixed route. It's an on-demand service. So
like a taxi in essence for medical.
I mean, for simplicity reasons, yeah.
And then they'll give you a ride back after your appointment to your house.
Correct.
But it's only within the network. So, like for example, I know there's Northwest Specialty Hospital. Mm-hmm. Are they included in that network? Because I would consider them to be a significant healthcare provider in the community.
Oh, they are, and that's definitely one that we're looking to address for partnerships later down the road because, again, this serves the community as a whole.
Well, yeah. I mean, it should, because otherwise it would come across that we're subsidizing buses through federal grant money for the benefit of one entity over another entity.
Yeah, and that's definitely, I mean, as I stated in the responses, they've gone to different locations throughout, so.
Yeah, well, I think it would be interesting and probably good to just have that documented because when you go to the Kootenai Health website, it kind of looks like it's a closed system, and that was one of the questions, and I think it's fair to say that FTA doesn't provide funding for closed systems.
So the on-demand system is what it is, and that's what they're looking for with the NEMT trips. So.
But even if it's I guess would it work the same if we had a university here, and we had on-demand trips for students from their house to class?
That would be under different classifications and requirements.
Yeah.
Yeah.
But that would not be considered a closed system at that point?
Well, again, that's under different requirements, and it's not the medical trips that FTA is looking for, so I can't speak to that because I haven't looked into those regulations, if there are any.
I mean, I'm familiar with the program in the sense that, you know, it works with seniors and disabled people. I mean, that's really what it is. So if you're in your 40s, you probably wouldn't qualify for this. Is that correct?
Not necessarily, because they will take individuals.
If you're not disabled? Like if I
Well,
called them
I
up?
mean, they would ask the questions, and so there is a possibility, you wouldn't be eligible for a ride. Yeah.
So I call them up and say, I got to go see the doctor. Come pick me up here
Yeah.
after this meeting. So, okay.
Well, and the other thing is you're not exactly in your 40s, but
Well, I'm older, so I'm actually closer to being qualified than not, I would say.
Yeah.
Okay. Well, any other questions, Commissioner Eberline, before we go to item number 2?
Nope, stated my case.
Okay. So the grant match, obviously, the operations, Kootenai Health pays for that.
Correct. Yep.
And the buses, we pay for that.
Yes.
And they're generating roughly, on average, about $100,000 a month in this operational cost that they're taking on.
Roughly.
Yeah.
Yeah.
Okay.
Yeah. There's months where it's above, and it's kind of moving towards being above 100,000 as the average now, just with the increased costs. So.
And how does that complement paratransit? Because, you know, we have this other system too, right, that we're accepting grant money for. We have these buses, they give people rides, right, which I presume would be largely to the same locations.
We do go to the same facilities with paratransit, but again, paratransit is a completely different program that's required by having a fixed route system. And so paratransit has a much higher qualification standard in order to be a part of that program, and it goes through a much different just qualifications, and you have to go through an interview and an application and everything before you can be on the paratransit system. So,
Are we doing anything to encourage other medical providers to be a part of this Kootenai Care Network?
well, that's something that internally as a transportation team is something that we have been discussing, especially this year, as we're looking for opportunities to just collect further funding towards the operations.
So we're not doing anything, we're just discussing.
At this
Doing
point in
something.
time, we're trying to figure out exactly what we can do and how
Okay.
we want to go about that. But there has been nothing presented to anybody at this point in time.
Do you have a deadline as to when you want to be able to present?
No, we don't have a deadline at this point. Obviously, it's something that we would have to bring before the board before we took it to anybody else, because we have to make sure that the board is okay with that. But yeah, I mean, we don't have a deadline as far as that goes. We've just been having discussions around it.
Well, it seems like, you know, just from my perspective, perhaps the board has a different perspective, that we should be actively contacting other medical providers in the county and letting them know about this service, getting them into this network. Otherwise, it looks like we're picking a winner and losers by saying we're going to buy these buses for you, entity A, for you, the benefit of you, and entity B, C, D, E, F, and G, well, sorry, there's nothing we can do for you.
Yeah. Yeah, I mean, that's why we've been talking about it and having discussions on how we could do that.
Well, you're welcome to have those discussions anytime, at least in front of me
Okay.
and perhaps the rest of the board. Do you have
Yeah, I agree.
so, Commissioner Duncan, do you have anything you want to add to that, or?
Nope.
No? Anything else on the match, Commissioner Eberline?
No,
No. Well, Chad, first of all, thank you again for providing the information. My hope is that moving forward, auditing can work more with you and get the information they need initially.
Again, they're welcome to request any point in time. We've never withheld anything from them, and we actually requested an in-person meeting from the information. So
Yeah. Well,
as an aside. So FTA, like everybody knows, is not going away.
No.
It's not going away in any way, shape, or form, so we have to find out legitimate ways to where we can work within it so that we can have good services, and that's my hope.
And that's exactly what we're looking to do, is provide the best services that we possibly can.
well, the kind of lost my train of thought here, but I think looking at the email chain, it wasn't as easy to get the information that was being requested. Like, for example, with the accumulation of the match in the spreadsheet. If you looked at the email that spreadsheet was in, it referenced an ITD grant. It didn't reference an updated spreadsheet. And it's probably best just to have the information in a central location so they don't even have to ask for it. It's updated, it's there, they can reference it anytime. Me personally, I will be less inclined to support requests coming from transit if auditing is having a difficult time getting information. So however your department and auditing work it out should be between you. But if I'm hearing from auditing that they're having a hard time getting information, again, I'm just speaking for myself, I will be less inclined to say yes to anything additional because their job is to keep us out of hot water.
And that's our job as well.
Well, I realize that, but they're the fresh set of eyes that are objective, that get to look over, and that's why there's writers and editors, And so it's really kind of the same thing here. So if that works for you, it works for an auditing.
Yeah, we've always done that. I mean, obviously, the board knows we're short-staffed, and we've been having to make sure that everything's in place that we do, and we've provided the information on multiple occasions to the auditor's office. And so, I mean, while it might not have been updated in the folder exactly, they still had the information present to them, so.
Well, I understand, and I guess the ultimate question to determine whether or not you provided that information is to ask them, do they believe they got that information from you?
It's in the email chains.
Auditing, do you have any comments on that?
I just always go to the G drive because that's where it's located. So that's what I did. And as far as the email chain that Chad referenced earlier, the subject was ITD 5310 award. I don't handle that, Arrow does, so I didn't even look at it. I had no reason to look at it. So I didn't know that information was in there, so.
Okay, well,
So
then,
for me, it's easy just to go, I mean, I know where it lives on the G drive. That's what I do for all of the stuff that we need. Snapshot information, Dorian puts it out on the G drive. That's where we go. It doesn't get emailed to us, but.
okay.
Yeah, and as soon as information's provided to us in real time, we update it and we have that available. So if it's ever requested, we're more than happy to give that forth. I mean, like I said, when we're short on staffing, we have to prioritize, and unfortunately, that's something that gets missed once in a while, so.
Can I ask you another question?
Yeah.
So, transit, Kootenai Health, how did they piggyback onto our standard routes?
Well, they don't piggyback onto the standard routes. I guess
They don't use the buses at all?
Well, we have stops that are on the fixed route that are located at Kootenai Health, and then in the health corridor as well as we have stops outside of Heritage Health. We have stops outside of Northwest Specialty Hospital. So, yeah, I mean, that's
And what about going up and down the highways?
like 95.
Mm-hmm.
We don't currently have stops that go up and down any of those, just due to being able to make safe stops in order to let passengers on and off. Going on 95 and everything would be a little bit dangerous, and it also would back up the bus route quite a bit on different occasions.
Is it restricted to in local areas, just in town, or?
Our fixed route? Our fixed route currently goes out into Post Falls, up into Hayden, and then into downtown Coeur d'Alene. So we have a pretty significant bus route that loops out and around Post Falls, goes all the way out to Spokane Street, and then it goes up to Honeysuckle and Hayden, and then it goes out to Sherman and 23rd for the A route. So, I mean, it covers a large area of the core of Kootenai County there.
Thank you.
Okay, well, my hope is that the auditing department and your department can figure it out so that they get what they need. I realize that you're busy, but if they can't get what they need, then, you know, we end up having meetings like this, and I think that is where it ends up costing a lot more time in the long run.
I would agree with that.
So with that said, unless either commissioner has anything else they would like to add or say, we can move to public comment. Yes.
There you go.
Okay,
You can sit.
sure.
I don't like.
I nibble. I've got several questions. First, does Kootenai Health have their own buses on top of these?
Well, this is public comment, so you make your comment
Okay,
and
you can take notes on it. And the other hospitals, do they go out and buy their own buses? It seems to me that we're in trouble here providing county taxpayer money to a private organization, and I've got nothing good to say about that. My tax dollars are funding one facility that's private. What if I live over in Harrison and I don't have any money? And I need the same, and I'm in the same destitute as these poor people that you're saying over here, that's their only service. Well, I'm sure that all the people that can't afford a bus ride to the hospital don't live on the bus route. And let's see, what else do I have here? So it's my understanding then, you're using my taxpayer money to buy buses.
federal
that-
grant money.
That aren't operated by the county. I just got done hearing that they've got their own bus drivers and they pay their own operation. But you're using my tax money to operate a bus I paid for. I think there's some legal questions that need to be answered here. I know you kind of have to answer them now. I hope that we can have a continuation meeting to provide full information to the county taxpayer.
Thank you.
Thank you.
Anybody else? Anyone on the line? 2:33, meeting adjourned. Thank you.